Hello again. So this is Ian Morley from the Regenerative Medical Group. This is our second podcast concerning men's health. And again, I'm delighted to have Dr. Suhail Hussain with me. Now, today we're going to talk about a taboo subject, which is men's sexual health. What are the signs that people should be looking for when they suddenly realize that something's not working?
All right. Well, thank you, Ian. It's good to be back again. So, as we touched upon briefly in the first episode, this problem manifests slowly. So, it's not something that happens overnight. It will build up over a period of time. So, there will be instances during intercourse where the man may find that he's unable to sustain an erection and then sex cannot be completed. Or then as the situation progresses, then it actually becomes difficult to initiate an erection. So basically intercourse is more or less impossible. But other things that may also manifest are the lack of or the decrease in early morning erections. Now, this is a physiological phenomenon where in the morning when men wake up, they have an erection. And they may find that the morning erections are either less strong or not present at all. So again, this is something that is suggestive that there may be an issue with the erectile function. So these are sort of the signs that one needs to be aware of and look out for.
What causes erectile failure completely or partially? The changes in the metabolic system so that it doesn't happen in the morning, and even worse, it doesn't happen when you want to have it.
Yeah. So I always say that the penis is a window into the heart. Now, what I mean by that is the penis, the erectile function is primarily due to two issues. One is arousal, so a psychological arousal, but number two is blood flow to that area because the erection only occurs when blood flows to the penis. So if there is compromised blood flow, that means you're not getting an erection. So if you're not getting blood flow to the penis, is there a suggestion that blood flow, in fact, I would say that there is quite likely a suggestion that blood flow elsewhere to vital organs such as the heart is also compromised. So it's really a significant issue. So blood flow and psychological arousal are the two factors that cause an erection to occur.
And some other genders might say, fairly or unfairly, that penis is a direct access to the average male brain as well.
Well, yeah, absolutely. So that's not joking aside. Again, if there's compromised blood flow to your penis, are you at risk of compromised blood flow to the brain and, God forbid, a stroke? That is a serious consequence that may occur. And I have read studies where they've done retrospective analysis of men who've had a heart attack, and they've asked them in a questionnaire, have any of you experienced erectile dysfunction in the last 5 to 10 years? And it was a staggering 70% of men answered yes to that question. So it is really important to think about that blood flow to the penis is not just a vanity metric, is really a significant clinical issue. There's another issue that I think we should raise is also testosterone. That's important to think about. We talked about testing in the first episode. So I think also testosterone levels, particularly above 35, 40, is important to check. But that is something else that could be kind of related to this.
And so some of these are like signal signs of not just about your sexual situation, but also about, maybe very importantly, other parts of your body functions as well. What can a man do about it?
So one, as I said before, being open and honest about it, having a frank discussion with your wife or partner and saying this is an issue. But number two, when you do identify the issue, don't sit at home quietly. Go and see your doctor, go and see your GP, ask them to do these tests. So these blood tests to check for diabetes, check your liver function, check your lipid profile, very important, check your lipid profile. I would also suggest checking your testosterone level. Get these basic bloods done, see if that shows up a problem. Are you at risk of diabetes? If there are problems identified, then get those problems rectified. But A, if there's no problems, or B, even if there are problems you wish to deal with the erectile dysfunction, we know there are treatments out there already. We've heard of these drugs. They've been around for a long time. Viagra, Cialis, what we call the PD5 inhibitors. They've been around for a long time. Pumps and vacuum pumps have been around. And then going to an extreme measure, going to see a urologist, the person who deals with this, they can inject the area with specific type of injections to try and increase blood flow. That's, I think, very extreme. I personally wouldn't be keen to try that.
Sounds
And the
a
other
bit painful
issues,
as well.
yeah, I mean, uncomfortable and painful. But the other issues have problems with spontaneity and the effectiveness of how well they work.
And with the various things that are available today on the marketplace, I mean, you already mentioned some of them, the Viagra, Cialis, those type of drugs. You picked up on the point that they are only immediately functionable. They don't last. It doesn't solve the problem, really, does it? It deals with the immediate causes, but it isn't a longer-term solution. Are there any things out there that deal with it on a longer term basis?
So, I mean, absolutely. So, A, as we've discussed, the spontaneity is totally ruined and the effect is limited. So, if you don't use, or if you don't have intercourse in the time period that you've used the Viagra or the Cialis, again, it's kind of wasted. But as we've said, the underlying issue is blood flow. So, if there is a treatment that deals with the compromised blood flow to the area, we are potentially looking at a long-term solution, not a cure, because I don't think this is a problem that needs curing, but a long-term, effective and reliable solution.
And I don't want to sort of unnecessarily scare anyone, but what's the medical evidence in terms of people who are perhaps already taking some drugs for high blood pressure,
Mm.
statins, beta blockers, things like that? Can you happily take Cialis at the same time?
Well, I mean, there are contraindications to taking them. So, for example, someone with significant cardiac disease already, so they've passed that barrier of the erectile dysfunction. So, there may be contraindications to using these drugs because they can affect your blood pressure. You can become hypotensive and have a significant event that way because blood flow is diverted to the penis. So, there are problems with these medications when used in someone who has cardiovascular disease in particular.
So even if you are considering taking some of these drugs, you shouldn't really do them before seeing your doctor and analyzing what you're already on and see if there are any contraindications.
Yeah, of course. That's another point well made. Drug interactions, again, really important to think about. So, are you on other drugs that lower your blood pressure? Are you on other drugs that may impair the effect of the Viagra? I would not advocate them myself for any medication other than simple paracetamol, etc. But you should consult a physician to discuss whether these drugs are appropriate for you to take, bearing in mind your past medical history and other medication you may be on.
So what else can you do that will increase the blood supply, perhaps offer a longer term resolution and isn't going to be drug related?
So, obviously, we're going to talk about this innovative treatment, which I'm glad to be able to provide to men, which is a ultrasound shockwave therapy. Now, ultrasound has been around for decades, used in physiotherapy to help with muscle sprains, also used in a diagnostic process, but interestingly used in kidney stone disease to break up stones. But that is a higher frequency. But when it's used at a slightly lower, a very specific frequency, it can cause regeneration and formation of new blood vessels. So this ultrasound treatment, which has a probe, if you like, which is applied to the penile area and the groin, will then hopefully regenerate blood vessels, cause new blood flow, and then increase that blood flow to the penis, meaning that you can now get an erection.
So this is truly regenerative medicine.
Yeah, we're making new blood vessels, or we're helping new blood vessels to form.
And so what's involved in the process? How long does it take? Is there any pain? And what does it cost?
So the process initially would be a screening to check you're appropriate for it. Also check the past history, which we discussed in the previous episode. The actual treatment itself is very simple and straightforward. 20 to 30-minute session where the probe is applied to the groin and to the penile shaft in dedicated time slots at a certain frequency and a number of pulses. And then you have that session. A week later, you have session 2 and 4 sessions altogether, each of about 20 to 30 minutes. So basically, you're spending 2 hours of your time to come and have a treatment that may give you months to years of potential lasting benefit.
I mean, that sounds very positive. And how do I start the process? And what's the chances of it being successful? And I guess my last question is, how much is it going to cost me?
Sure. So the chances of success, I mean, as we've seen with the research that's been done so far, there's an 80% success rate, which is massive. I mean, even Sir Ian Botham had this treatment and he was raving about it. So 80% success rate for potentially several months to years of lasting effect. The process is you inquire and we check if you're suitable. The cost is £500 per session. So for 4 sessions, that would obviously be £2,000. Potentially for diabetics, I may need a couple of extra sessions, but that's basically what you're looking at in terms of cost.
Okay, that's a lot less than following England on a test match abroad.
Yeah, absolutely, yeah. And I don't think Botham will be there playing now. He's probably enjoying himself.
Commentating.
Or commentating, yeah.
Great. Okay, that's really interesting. I hope everyone's found it interesting. I certainly have. To find out there are other ways of treating ED besides just tablets that are quick, that are relatively not too expensive, have some longer term solutions, and a fairly good rate of success, and are available today through Dr. Hussain.
Yeah.
Good. Thank you very much indeed, and thank you everyone for listening.
Thank you.